very good afternoon. Thanking to the Odisha Ophthalmic Society and All India Ophthalmic Society, I venture to take you to this through this important initiative on real-time ROP telescreening that we adopted to address a huge gap between the ever-rising number of preterm births and ROP-related blindness in India and so also in Odisha. So these are the different types of ROP, the strategy to address the ROP-related blindness across the world. This includes in-person ROP care at the bedside, where the ophthalmologist or ROP specialist goes to the patient in the neonatal intensive care unit and deliver care. The second is the babies referred to the ophthalmic unit, but this is always not feasible. Many a times babies are sick and transferring them can be at risk. So to address this gap, the telemedicine have come to our help, where trained photographer go take the images of the babies at the bedside. They capture the images, store and transfer it to a remote ROP specialist who analyzes it and communicates the result to the patients or to the local paramedics. But the lacunae here is that there is lack of a patient-doctor connectivity. Many times, many thinks that this is just a technician-driven. To address this gap, we developed something called as real-time ROP telescreening, where the monitoring of imaging, analysis, counseling, checkout, everything happens in real time. And this we published in IJO, which has got an award for this year. Now, what is real-time ROP telescreening? The trained paramedics go to the periphery. They take the images of the babies at a remote periphery, and these images are taken in a laptop where the video conferencing software is already installed. So this is being tracked by an ROP specialist sitting at a command center at any distance. Now this finally, when the images are taken, the ophthalmologist and guide can track and guide the photographer to take image any particular area or clarify any doubt. And finally, there happens a face-to-face communication with the patients. They are counseled and they are the baby's disease profile is communicated. Finally, the parents, out of the 50, 60, say 100 babies, few of them come to the ophthalmic unit for treatment. What are the advantages? In addition to the advantages of telemedicine, the uniqueness number one is that the re-imaging is feasible in case we want to focus on certain area which is not clear in the picture. The available technology all everywhere misses this, but here we have an opportunity to take again real-time training on a wide scale, like any number of doctors can get logged in and get trained during the face-to-face analysis and discussion with the subject. The group counseling becomes easy. Group counseling where the patient comes over, the RBSK staff comes over, the pediatric support staff comes over, our team who are going to receive the babies also comes over, and at a time everyone talks to face and things get sorted out, and so that when the baby comes for treatment, everything goes on smoothly and they get treated quickly. So this is just a 1-minute video on our experience over 1 year. So this got awarded at the Project Management Institute, the project of the award NGO category. So these are the few numbers. Over the last 2 years and 9 months, 1,062 telescanning sessions, almost 11,407 imaging, and 8,807 preterm baby screened. What is important is 1,262 eyes have been treated over 2.5 years, which is a huge number, and this was possible because of the technology. Few examples like this is this left out baby, unknown baby in the jungle of forest of tribal area in Mayurbhanj, got rescued and treated by this technology, and there are many such examples. So to conclude, real-time ROP telescreening has many advantages over existing telescreening model for ROP. The important ones include monitoring and re-imaging in real-time feasible, face-to-face interaction or group counseling has many advantages, excellent scope for training and documentation, but this has resulted in a huge scale of our program in the state, but there is a huge way to go, and I acknowledge the support from all of them shown here. Thank you so much for your kind listening.
Thank you, Dr. Tapas. You want to ask a question?
Sir, how do you see the future for real-time ROP screening in India?
So I got excited when I introduced this. I introduced this during COVID time, but I slowly realized there are two hurdles here. One is the image. The person who is taking imaging has to be very skilled. Number two, you need to have a very good internet connection. If you don't have in the periphery, then sometimes the pictures might not be adequate quality. The third is, if the examining ROP specialist also need to be there in real time, that also takes away some of the time. So what we have modified it, and where a second level photographer who are trained and certified to detect treatment warranting ROP can sit and decide on which are the babies or filter out who require treatment. Those 2 to 3 can be shown to the ROP specialist. So that way, at one command center, you can connect to multiple areas in a day, and we can connect to entire all the districts in the state.
Even AI can also help to screen out the normal babies who are not to be
yes.
followed.
So AI model can very well be incorporated in this. Actually, that will be again another future for this.
The future is great.
Thank you so much.